Welcome to Legal Nurse Podcast. This is your spot to get inspiration, tips, stories, and guidance to help you in your legal nurse consulting practice. I'm Pat Iyer, the host of Legal Nurse Podcast since 2016. We are among the top 5% of all podcasts in the world in terms of longevity and sharing information consistently week after week with legal nurse consultants. Sit back, relax, and enjoy the show. Welcome to Legal Nurse Podcast. My name is Pat Iyer, and I am the hostess of this show. We have been broadcasting Legal Nurse Podcast every week for the last 9 years, starting in September of 2016. And that puts this podcast and you listening in an elite group of 1% of all podcasts in the world can claim that type of longevity and reach. In this episode, we're going to focus on something that affects you as a legal nurse consultant as you are working with clients and their clients, if that's the injured patient, for example, with the expertise of a case manager who has 35 years as a registered nurse, working mainly in critical care areas until he became a case manager. He is a certified case manager and has been certified since 2011. And when he's not recording a podcast with me, he can be found at the gym or the golf course, or he can be advocating for his clients. Please meet Larry Boyd. Larry, welcome to the show.
Hi, Pat. Thank you so much for having me here today. I really appreciate this opportunity to talk with legal nurse consultants about certified case managers.
I know that many people who are intimately involved with law firms as employees or working extensively as independent LNCs come across the term case manager. The attorney says, oh, well, my case manager will come into this meeting and we're going to have a strategy session. What's the difference between the role of the medical case manager and the legal case manager?
Well, as far as we'll start with the legal case manager, because I think a lot of LNCs work with them on a very regular basis. And what they kind of are is they kind of coordinate things and for the attorneys. So what they'll do is they'll oversee and pull all the records together, schedule meetings, try to encourage communication amongst the clients, gather information that way. But they usually work in-house for that law firm. I mean, there's other people use them. Some HMOs do use them too, and insurance companies, but usually it's legal firms that have them in place. Now, the medical case manager, that is someone who actually oversees the medical care of the client. So from the moment, sometimes actually while they're still in the hospital, but ideally from the moment they leave, that case manager is going to make sure that that client has all their needs met as far as whatever they might need in place for their recovery from that specific injury. So there's the term case manager, I know, is being used quite widely in various settings, actually, which has been posing some, I guess, what you would say, some challenges as far as explaining really what does a case manager do. So, but yeah, so those are the big differences. The legal would be more in-house for the lawyer, keeping his cases together, and the medical case manager is external, and they're working with that client and they're treating providers.
And as you're describing the role of the medical case manager, it sounds like an active role, an advocate role. Is there another role that case managers can be assigned, which is being a scribe?
Well, I guess when you and I spoke before, I kind of used that term scribe case manager, and that's something I guess that I kind of coined myself after either picking up files that were handled by another case management company or talking to other case management companies and kind of how they go about their business. So how I would describe a scribe case manager, I guess, is they really would be called a nurse case manager is usually what they would be called through that case management company. But they don't have the experience or the background to really go in and truly advocate for that client, whether it's clinical background or whether it's training, working with another certified case manager and then becoming certified themselves. So what a scribe would do would probably a good example would be they would go to an appointment with a client. They would sit down with the client, sometimes go into the appointment, sometimes just wait in the waiting area. And as the doctor examines them, they more or less would just take notes, and then they would ask for any type of updates as they were leaving the visit. There's really no interaction a whole lot between them because they don't really have that clinical background to ask those probing questions or to have that insight into knowing that their client's not recovering really as you would expect them based upon their injuries. So what else can we possibly do? You know, do we need a change in the medical plan? Do we need to maybe get an evaluation by a specialist? Do we need to, you know, so these are the things that a certified case manager and someone with that clinical experience can truly go in and advocate for their client. Most clients aren't going to know what to ask. Even as you know, you and I, we go in and we're going to go see our doctor for our yearly, and we'll ideally we'll write a list of things out to address as we go in. Sometimes we'll say, oh, I'll remember that. And then you'll walk out and go, oh, I forgot to ask them about that. So that's kind of what a case manager does. We go in there prepared. We talk to our clients prior to the appointment, and then we already kind of have an idea of what we want to ask when we go in, based upon where they're at in their recovery status.
So it sounds like the scribe is more of a junior role or an apprentice role in the beginning of that person's career before they build up the hours and the experience that they need to become certified.
Yes, yeah. Often they'll be like an inexperienced nurse and they have a lot of clinical background. A lot of times they won't even have 2 or 3 years, and then they'll be hired by a case management company to come and be a case manager. So they, beyond being a registered nurse, they really don't have a whole lot of extra training before being thrown into that role. And of course, the reason for that is for the case management company is the bottom line. They can pay these inexperienced nurses less than what they would pay someone who is a certified case manager.
Well, and let's focus on the payment issue, because I know that that's a question that some of our listeners may have is who hires case managers? Who pays for their services?
Case managers, well, case manager work for their client. So that is their client. The injured person is their main client. They may not be the payer source. On occasion they are, but usually not. In Michigan, personally, I handle quite a few auto cases and worker comp cases. So I bill out directly to the insurance companies for my services. But then again, there are individuals that may pay for that. They may want to have a case manager say they're having a surgery and they're coming home to recover. And they're concerned about making sure they want to recover well, or their family's concerned. Well, they might call a case manager and say, hey, my dad's getting discharged tomorrow after the surgery. We want to make sure everything's in line and he recovers well because he had a complication last time. So a case manager would say, okay, fine. So we'd go in, and even before he gets discharged, we'd find out, okay, what's going on? Where are we with this person? What is your discharge plans for this person? Are things in place for them to be safely discharged home? And then making sure that that home environment is set up appropriately for their recovery. So we can be utilized, I guess, in different facets, but for the majority of the time, the insurance carrier is our main payer.
Mm-hmm. And I know that there are times that LNCs will interact with case managers. Can you give us an idea about how those two roles may intersect?
Yeah, well, I think what it is that a good case manager brings a lot to the table for that LNC working that case. Oftentimes, they can provide like a real-time status update regarding that client, and what current treatment plans are going on an ongoing basis, which is important as you're preparing for this trial. A lot of times they may be able to answer questions for the legal nurse consultant regarding the clients, how they're recovering. And then some of those questions that aren't usually found in the medical records, like what's their living situation like? What's their support system like? Are there potential obstacles to the recovery because of their environment? Those type of things. So those are things a lot of times you can't get from the medical records. And as an LNC, that's kind of where the LNCs are. You request those records, and then you do your review based upon the documentation you're provided. Sometimes you can speak to the client, sometimes you can't. It's rare that you can speak to the client's family, whereas a case manager interacts with the client, their family support system, pretty much everyone that's involved in the recovery, their therapists, physicians. So we're kind of like a really quick access to, hey, what's going on? Or I came across this, that's not making sense to me. Is there something missing out of the records? That's, as an LNC, that's one of the main things that you want to do, is not so much being able to look at the records, being able to look and say, hey, what's missing? Right? So sometimes it may not be clear. So you can go to a case manager and say, something's not right here. So, and then they'll be able to do that. So, case managers, we do pretty regular updates, either every 30 or 60 days, like a medical status update. We share that with everybody, including the insurance company, since they're the payer, correct? That's shared with the client, that's shared with the client's attorney if they have one in place, and the legal nurse consultant gets it. So that keeps them updated too. So they may not have to pick up that phone. They'll say, oh, Larry's report came in. Perfect. Okay, here's where we're at with this guy. So that's kind of really where I think that those roles would intersect. Also, sometimes they might assist in developing some questions, that could be used maybe for depositions or things like that, because they're the ones that can say, oh, well, hey, what about this? Or, hey, we know that this is in place. What's their response going to be to that? So, which may not be, once again, contained in those records, and the client may not come out with it. The client may not be able to, depending on your client. I work a lot with traumatic brain injury clients and spinal cord injury clients. So I do a lot of catastrophic injury case management. So, and in that case, those clients sometimes aren't a really great source of information. They might be great historians on things from 20 years ago, but what happened since the accident, they may not. So that's where you have to tie into the family and be able to really assess, okay, what's going on with this person and how am I going to be able to help them the best I can? And so then we can share that with the LNCs.
I would love to welcome you to our new revised continuing education program for LNCs called LNCEU. This is like a book of the month program in which you receive either 2 videos or a video and a book written by me, all designed to help you attract more clients, get more cases, and feel more confident in providing services to attorneys. You can choose between content designed for you as a new LNC or as an experienced LNC. There are 2 bonus programs that come along with this program. The first of these is how to create a tight resume or CV to avoid the landmines that might be lurking in your CV. This is training that I did with a nurse attorney, Arlene Klepatsky, to help you format your resume to make a strong impression and identify red flags and flaws on other people's resumes. You'll get some practical tips that you can use immediately to evaluate your resume. The other video training that comes along as a bonus when you join the program is LNC Subcontracting: How to Boost Your Business. And this is a 1-hour video training that gives you the perspective of, if you want to be a subcontractor, what you need to know in order to do that, or if you want to start subcontracting cases to other people, what do you look for in those people and how do you help them excel in their role? That is a bonus training that comes along when you join LNCEU. Go to this link to join us. lnc.tips/LNCEU. And I'll see you at one of our monthly open office hours when you have an opportunity to ask questions and learn from the questions of other people. I can think of a couple of situations, Larry, that allowed me to interact with case managers that I'll interject with. One involved a construction worker who was working on a building, lost his footing and went headfirst down a chute into a big dumpster, and he was trapped in the chute. It was too narrow for his body and it was compressing his lungs. He was able to reach his phone and call his brother and tell him he was trapped in this chute. But then, because of the amount of time it took for the people on the site to be able to recognize the problem and extricate him, he suffered an anoxic brain injury. I had a chance to talk with his case manager who handled catastrophic cases because the attorney was very focused on wanting to know how much conscious pain and suffering this man had, and initially asked the case manager to pull that information out of the records, which he worked on. And then I took over and completed a chronology of his more extensive medical care. He was transferred from the hospital into a nursing home. He could move his eyes and sometimes responded to stimulation, but there was very limited ability for him to be able to communicate, or even for us to know how much awareness he had. And then in the other instance, there was a woman who was catastrophically brain injured in the delivery room, and the rehab facility was intent on getting her discharged to her home, where her social situation was not set up to have the ability to provide the care that she needed. She couldn't walk or talk or feed herself or do anything. And it was overwhelming to her family to think about taking her in, and also extraordinarily expensive to have her at home with 24-hour-a-day care versus in a nursing home, which is where she eventually went. So the case management company was hired by the attorney to come in and say to the rehab facility, oh no, you cannot put her in a wheelchair and push her out the door to the family. This is not going to work. We don't have any resources. At that point, the lawsuit was still active, and there was no money to pay for her care. She needed $40,000 a month just to manage the medications and the feeding and the nurses and, all of that demands. Do you have any comments about either one of those scenarios that I've shared with you?
Well, yeah, I guess start with the most recent one, actually, and that's the discharging when the client's not able to be or should safely discharge. And that definitely is where a case manager would be able to come in and advocate for that client and family. And 9 times out of 10, you're going to be at the in administration within 5 minutes at the hospital. Because quite honestly, the floor nurses are doing what the orders are. You can try to talk to the doctor possibly, but they're getting pressure from upstairs to discharge this person. It's a financial decision. So, but legally, no, they wouldn't be able to discharge that person if it wasn't a safe environment for that transfer. Whether it's, from any facility, especially if it's from an acute care facility, but even a nursing home, they can't, if someone's say they go to a subacute rehab, which would be a nursing home, but they're there, say, for a few weeks, and they want to send them home also. Say it's an elderly person, they had shoulder surgery. Okay. They couldn't go home after the surgery because they couldn't care for themselves, but they didn't require acute inpatient rehab. So they could go there. And that's another instance where I've seen them trying to discharge someone before they should. That's exactly what a case manager does. I mean, you put on your advocate hat and you walk down to who you need to talk to and say, no, this is not happening. So, you kind of sometimes have to play that role. It's rare that it gets to that point, but yeah, it definitely, I could see that occurring. So, and it has occurred and it does occur. And sometimes, a lot of times when it occurs, the family, there's no case manager assigned to that file anyways. If it's like, unless someone's a private pay, if they weren't an auto related or worker comp related file, they wouldn't have someone like that advocating. Now, a lot of facilities have their own in-house case management, but they're in essence discharge coordinators. That's what we called them, forever, 30 years ago, discharge coordinator. Here they come. Let's get them out of here. Right. So yeah, that's a big issue. And once again, if they don't have that advocacy, if they don't have someone in the family that knows at least, then that's what's going to happen. And then the most likely they'll be back in that hospital within a couple of days because they weren't able to manage at home.
Mm-hmm.
So, that's a whole thing with the case management and getting Medicare on board, I guess, in a way, to say, hey, why aren't you picking up this cost? That's still not something that we can bill directly for. Now, I think it was last year, they actually, CMS enacted a couple new patient care coordinating codes. So they could do that in essence. It's like case management, but it's through under the auspice of a physician. So it's still not a real clear path, but that's really where a lot of these the ACOs are kind of going to. They're utilizing that to generate extra income. Say, hey, we'll hire people to do this. But once again, the people they hire are usually, a lot of times they're just telephonic nurses that are looking for something to do besides working in a hospital. It's not like they're a certified case manager. They give them a sheet and say, here, this, and this. And this is what you have to go by. So.
And a couple of abbreviations just slipped into the conversation, Larry. CMS and ACO. For our listeners, could you define those abbreviations for us?
Yeah, well, the CMS is what oversees the Medicare billing in essence. So they're the ones that set all the billing codes for different medical services that the providers can bill out for. And they've been around for forever. But I think they're starting to get a handle on kind of the importance of that. And it's actually, believe it or not, I believe it was, I read an article on it last year before they went through, and I think it was Jill Biden that was pushing it. And it was really geared toward cancer patients and having people assist them and navigate through, because that's a scary time for everybody. If you think about the what ifs. So that was the big push behind that. So, the ACOs are what they call their accountable care organizations, and those were put in place to try to. They get kind of more like a lump sum payments for things to manage people's care overall, and it could be a portion of their care, or there's some of them. Like around here, there's a big one now called Oak Street, and I think they're throughout the Midwest. And that's exactly what they do. So they have physicians, they have their own therapists, they have everybody right there to manage that person. And ideally, that's great because it should increase and improve the communication amongst team members. So I guess in theory, it's good. And then once again, so they're able to hire people just for that role to do those monthly calls or whatever it is, to do status updates on that client. But once again, that's more of a hands-off telephonic type, how you doing, almost like a remote patient monitoring type systems. Those are, I'm sure you see them on LinkedIn. There's a lot of these companies that are like, hey, we can improve this and you can bill out for it. So yeah, so anyways, that's kind of it. So the ACOs, I think in theory are great. But once again, I think they're going to need some tweaking too, and I think they're finding some of this as they go through. But yeah, so that's kind of the billing situation. So I mean, if I were to make one wish, my one wish would be for Medicare to start paying for external case management. because I know it would be a tremendous savings across the board. The readmission rate would be probably, I would say, cut close in half, maybe at least 30% of these people. So it's like, well, if you want to save money, let's treat them and then keep them healthy versus treat them, send them home, bring them back, treat them, send them home. And we've been in that type of system now for ever since I've been a nurse. I worked the emergency department for a long time, and we had our frequent flyers. That's what we called them. Here they're back again. Did you follow up? No. Well, we gave you the doctor's name, and but there was no one to actually step them through it. So, and that's kind of what an ACO does. They step them through it.
I know as we talked about the role of the case manager, we've touched on communication skills. We've touched on being able to explain things to the patients and the providers and the attorneys. Can you tell us a little bit more about the skills that go into being a case manager?
So as far as qualifications go, if you want to be certified, first is you have to be a licensed healthcare provider for the state. So a majority of case managers are nurses. There are medical social workers that are certified case managers, as well as there are some physical therapists and some physicians that have got become certified case managers. Now I actually noticed a lot more nurse practitioners are starting to get involved, which is kind of neat to see. Second is you have to have a minimum of a bachelor's degree. So once again, if you're a nurse, you have to have your BSN to even be considered to be certified. And that's something I think that they're going to stick to for a while. And I think that's important. That's a whole nother soapbox. But and then you have to work 2,000 hours under the auspice and oversight of another certified case manager as like a mentor type scenario. But I believe it was in 2020, they did some changes to that requirement. So they added the work experience could be 4,000 hours as a case manager, but not directly supervised by a case manager, a CCM. You still had to have letters of recommendation and something from your supervisor stating that the role that you worked was in a case management role and that it applied to what a case manager would do. And they decreased the actual patient contact time, because it used to be like you had to spend like 30% of your time had to be the direct client contact. Now it's down to 20%. And once again, I think that was because of the increase in the telephonic case management that's occurred because of the managed care HCO type scenarios. And their reasoning too was that, to remember, they think that it would allow like more people, more professionals would have that opportunity to enhance their knowledge base and be able to practice case management as the case management, wants you to do, the Commission for Case Management Certification. So under their guidance, whatever, their ethical standards or practice standards, that type of thing. So, that's kind of where we're at. And just kind of off the cuff too, I know when I first got involved in it, I would say a majority, if not all the case managers I met that were certified had at least 10 years of clinical experience, which is imperative. Once again, you can't really advocate for somebody if you don't know what you're trying to advocate for, if you're not able to identify something that's missing in the recovery. So there's no way you could work a med surg floor for 2 years and then become a case manager efficiently. I don't believe. So once again, if they can pass the test, then they would be certified. The test is not easy. It's about, I think there's a total of like 4.5 hours of testing over 6 hours, something like that. And they do test you various settings. So, because we have inpatient case managers, external case managers, but when you get certified, they want you to be able to fly pretty much in any realm. So they can ask you questions from various settings that you may find yourself in as a medical case manager, which is nice, because it does give you some appreciation for the internal case managers and what they do. So.
Well, Larry, I know we could speak for hours on this topic, and it's clearly one that you feel passionate about and have a lot of experience in. What would be the best way for people to be able to reach you? And let me also be clear, you do provide expert witness services related to case management issues as part of your skill set. How could they connect with you?
Well, they could either, my email is probably the best way. My email is mriadvocate@gmail.com. I do have a website. It's pretty simple, but it has all my information on it, and that's it's www.mriadvocate.com. And then my number, that's usually the best way to get a hold of me, is 231-631-5060.
I appreciate your expertise and your passion in this topic. It sounds like a vital role that helps patients wind their way through a complicated healthcare system where there are often barriers to being able to obtain the healing that they need. This program will be followed next week by another program, so hang on for another few minutes. Find out what's coming up next on Legal Nurse Podcast. Be sure to go to legalnursebusiness.com, take advantage of our newly revised website where you'll have an opportunity to answer some questions about what's of most interest to you and get our free reports and resources directed to helping you with your needs. Hang on next. Thank you for being part of the Legal Nurse Podcast audience. I'm delighted that you've joined us for this episode. Be sure to go to legalnursebusiness.com and get your free reports, look around the website, pick up some tools that will be useful for you in your legal nurse consulting practice. And be sure to join us for the next episode.